Diagnosis of canine heartworm infection or Dirofilariasis. The disease can be diagnosed based on the clinical signs that I have already discussed. Radiography may reveal the thickening of the pulmonary artery. Angiography may also be used to demonstrate more vascular changes. The simplest way to diagnose this infection is to examine the blood smears. Just take a drop of fresh blood on a glass slide and put a cover glass on it and directly observe under a microscope. Wriggling movement or active movement can be visible in positive cases. Further, a thin blood smear with 10% Zimsa staining can also confirm the positive case. A thick blood smear can also be done in case of subclinical infection or suspecting a lower number of microvilli in circulation. Thick blood films made from the marginal ear vein may give the best results. In addition to the examination of blood smears, the modified Knott techniques can also be performed for the differential diagnosis of Microfilaria of Dirofilaria immitis and Dipetalonema reconditum. For performing the modified Knott techniques, take 1 ml of blood with 9 ml of 2% formalin. Afterwards, centrifuge it at 1500 rpm for 5 minutes. Discard the supernatant and examine the sediment after staining with 0.1% methylene blue. In positive cases, the Microfilaria of Dirofilaria appeared as slightly curved body with tapered anterior and straight posterior end. On the other hand, the Microfilaria of Dipetalonema has a straight body with blunt anterior end with a button hook-like posterior end. Micropore filter techniques can also be used. In this case, 1 ml of blood in sodium citrate or other anticoagulants is first lysed with 0.1% sodium carbonate or so. Then the blood is passed through a filter with a 3 micrometer porosity. The filtrate is then stained with 0.1% methylene blue and examined under a microscope. Examination of Buffy coat can also be tried for the detection of Microfilaria. Antigen detection ELISA can identify the mature worm antigen but not the Microfilaria. It is noted that the Microfilaria may not be detected in 5 to 20% of Dirofilaria infected dogs. Therefore, clinical history, clinical sign, and thoracic radiograph along with electrocardiography are recommended.